the borderline symptoms that 3% of the population have and don't know. Experts simply explain everything. Have you ever wondered why some people seem to live on an emotional roller coaster? Why do some people you know oscillate between intense love and deep hatred within a matter of hours? Today, we're diving into the universe of borderline personality disorder symptoms, a territory often misunderstood but affecting millions of people around the globe. Imagine waking up every day not really knowing who you are. Imagine feeling that every relationship is a matter of life or death, where a delay of just 5 minutes can trigger a devastating emotional storm. This is the reality for those living with borderline symptoms, a condition that goes far beyond the stereotypes society has created. Maria's story perfectly illustrates this. At 25, she lived in a constant cycle of intense relationships that began like fairy tales and ended as nightmares. One day, her boyfriend arrived 10 minutes late for a date, and Maria interpreted this as a sign he no longer loved her. Her reaction was disproportionate: tears, accusations, and a feeling of emptiness that lasted for days. What many don't understand is that borderline is not a choice or a lack of personal control. It's a complex disorder that affects about 5% to 3% of the world's population, manifesting through specific symptoms that can be identified and treated. Dr. Luciana Gusmão Abreu from Hospital Pequeno Príncipe highlights that patients with early diagnosis have up to a 74% chance of remission. We live in a society that quickly labels people with borderline symptoms as dramatic or unstable, not realizing that behind these behaviors there are altered neurobiology, unprocessed traumas, and a desperate search for connection and safety. The contradiction is clear. While we approach and treat other medical conditions with empathy, we still stigmatize personality disorders. Borderline symptoms don't appear out of nowhere. They're like smoke signals from an internal fire that needs to be extinguished with understanding, not judgment. Each mood swing, intense reaction, and fear of abandonment tells a story of pain that needs to be heard and welcomed, not minimized or ridiculed. Early identification of these symptoms can be transformative. When a person finally understands that their intense feelings have a name, that their experience is valid, and that there is treatment, something fundamental changes. The relief of knowing you are not crazy or broken is the first step toward healing. The Diagnostic and Statistical Manual of Mental Disorders sets out 9 specific criteria for identifying borderline. At least 5 must be present for a diagnosis. Each symptom is a puzzle piece that, when assembled, reveals not a life sentence but a map toward recovery. The journey of understanding borderline symptoms is also a journey of human compassion. When we look beyond behaviors and see the suffering person, when we replace judgment with scientific curiosity, we open doors to healing that once seemed hopeless. Knowledge of borderline symptoms is not just to identify the disorder, but to build bridges of understanding between sufferers and those who love them. It is a tool for social change that can break cycles of misunderstanding and isolation. Over history, our understanding of personality disorders has evolved dramatically. In the past, people with borderline symptoms were often institutionalized or simply marginalized by society. Modern psychiatry now recognizes these symptoms as manifestations of a treatable condition, not character flaws. The concept of borderline personality was formally introduced into psychiatric literature in the 20th century, but the symptoms we recognize today were described by thinkers and doctors much earlier. Freud, in his observations of human nature, already identified behavior patterns we now understand as borderline spectrum symptoms. The evolving understanding of these symptoms reflects the evolution of mental medicine itself. We left an era where neurobiological differences were seen as moral failings, moving to an age where we recognize the complexity of the human brain and its many forms of functioning. Carl Jung, with his theory of archetypes, helps us understand that borderline symptoms can be seen as extreme manifestations of universal archetypes. The orphan who fears abandonment, the lover seeking intense connection, the destroyer who sabotages their own happiness. This perspective adds depth to the clinical understanding. Modern neuroscience reveals that people with borderline symptoms show specific alterations in brain areas responsible for emotional regulation, like a hyperactive amygdala and a less developed prefrontal cortex. These discoveries completely transform our understanding of the disorder. The psychiatric deinstitutionalization movement of the 1960s and 1970s brought new perspectives on borderline symptoms. For the first time, it was recognized that people with these symptoms could live full lives in society as long as they had the proper support. Dr. Marsha Linehan, creator of dialectical behavior therapy, revolutionized borderline treatment by developing specific techniques for dealing with symptoms. Interestingly, she later revealed that she herself had lived with borderline symptoms, bringing a unique and hopeful perspective to the field. The social construction around borderline symptoms also reflects questions of gender. Statistically, more women are diagnosed with borderline, which raises questions about how society interprets and pathologizes intense emotional expressions in different genders. Epidemiological studies show that borderline symptoms often coexist with histories of trauma, especially relational trauma in childhood. This does not mean all trauma causes borderline, but there is a significant connection that cannot be ignored. The cross-cultural perspective shows that although diagnostic criteria are universal, manifestations can vary significantly among cultures. What is considered impulsiveness in one culture might be seen as spontaneity in another. The mental health service user movement brought authentic voices into the debate about borderline symptoms. People with the disorder began sharing their experiences, humanizing a condition long seen only through clinical lenses. The integration of traditional medicine and holistic approaches into borderline symptom treatment represents a significant evolution. Practices like mindfulness, once considered alternative, are now valued complements to conventional treatment. The first fundamental symptom is intense fear of abandonment, real or imagined. This fear isn't just normal relationship concern, but a visceral terror that can be triggered by seemingly insignificant everyday situations. A person may panic when their partner takes too long to reply to a message or when a friend cancels a meeting. Dr. Karina Calderoni explains that this fear of abandonment is deeply rooted in the neurobiology of the borderline brain. The amygdala, responsible for processing fear, is constantly hyperactive, interpreting neutral signals as threats of abandonment. It's like living with a faulty alarm system that's always going off. The second characteristic symptom is unstable and intense interpersonal relationships. People with borderline tend to idealize others quickly, putting them on unrealistic pedestals. When the person inevitably disappoints, the fall from grace is deep and devastating. This dynamic of idealization and devaluation isn't conscious manipulation, but a distorted emotional process. The person with borderline truly believes the other is perfect when idealizing them and truly believes they're terrible during the devaluation phase. The third symptom is identity disturbance, manifesting as instability in self-image and in the perception of oneself. Imagine waking up every day not exactly knowing who you are, with values, interests, even physical appearance seeming to change with your mood or circumstances. This instability can lead to frequent changes in careers, groups of friends, lifestyles, and even sexual orientation. It's not simple indecision, but genuine confusion about one's essence, as if you are an emotional chameleon who changes color with the environment. The fourth symptom is impulsivity in at least two potentially self-damaging areas. This can include excessive spending, unprotected sex, substance abuse, reckless driving, or binge eating. The impulsivity is not a conscious choice, but a compulsion that's hard to control. Neuroscience shows this impulsivity is related to deficits in the prefrontal cortex, the area responsible for executive control and decision-making. It's like having a very sensitive emotional accelerator and poor brakes, leading to actions the person often regrets. The fifth symptom is recurrent suicidal behaviors, gestures or threats, and self-mutilation. These are not necessarily attempts to die, but often ways of coping with unbearable emotional pain or attempts to communicate suffering when words are not enough. Self-harm especially serves as a dysfunctional form of emotional regulation. Physical pain can temporarily relieve emotional pain, creating a vicious cycle that's hard to break. It's important to understand these behaviors are symptoms of deep suffering, not attention-seeking. The sixth symptom is affective instability due to marked mood reactivity. Mood changes in people with borderline are more intense and longer lasting than normal fluctuations. They can last hours or days and are often disproportionate to the trigger. This instability is not drama or oversensitivity, but a real neurobiological difference in how the brain processes and regulates emotions. It's like having a defective emotional thermostat that can't maintain a stable temperature. The seventh symptom is chronic feelings of emptiness. It's not sadness or depression, but a persistent sense of an internal void, as if there's a hole in your chest that nothing can fill. This sensation can be more disturbing than acute emotional pain. This chronic emptiness can lead to compensatory behaviors like intense relationships, addictions, or risky behaviors in a desperate attempt to feel something, anything, that fills that apparently insatiable inner void. The eighth symptom is intense and inappropriate anger or difficulty controlling anger. This anger can be triggered by minor frustrations and manifest through sarcasm, bitterness, or verbal outbursts. The intensity is often disproportionate to the trigger. After these outbursts of anger, people with borderline often feel intense shame and guilt, reinforcing low self-esteem and perpetuating a vicious cycle of emotional dysregulation. The ninth and last symptom is transient, stress-related paranoid ideation or severe dissociative symptoms. During periods of intense stress, the person may experience a disconnect from reality, a sense of unreality, or even brief hallucinations. These dissociative symptoms serve as a psychological defense mechanism against unbearable emotional pain. It's as if the mind creates an emergency exit when reality becomes too hard to bear. Manifestation of these symptoms in daily life is complex and multifaceted. In the workplace, this can result in conflicted relationships with colleagues, difficulty dealing with constructive criticism, and a tendency toward professional sabotage as success approaches. In family life, symptoms can create dysfunctional dynamics where the person alternates between extreme dependence and rejection of family members. Parents, spouses, and children often feel lost, unsure how to help or interpret apparently contradictory behaviors. The social life of people with borderline symptoms can be marked by intense but brief relationships, difficulty maintaining long-term friendships, and a tendency to isolate during periods of greater emotional instability. Symptoms also significantly affect academic life. Students with borderline may show inconsistent performance, trouble completing long-term projects, and a tendency to drop out when nearing completion. Relationships with one's own body are often complicated. In addition to self-harm, there may be distorted body perception, dysfunctional eating behaviors, and trouble caring for one's physical health. The financial aspect is also affected by the impulsivity characteristic of the disorder. Compulsive spending, difficulty maintaining steady jobs, and a tendency to make financial decisions based on momentary emotions can create significant problems. Borderline symptoms also impact sexuality. There can be swings between promiscuity and celibacy, trouble setting healthy boundaries, and a tendency to use sexual relationships as a way to regulate emotions or avoid feelings of abandonment. Spirituality can be both a refuge and a source of conflict. Some people find stability in religion or spiritual practices, while others may experience intense existential crises related to the symptoms. Now we come to the point of breaking one of society's biggest lies about borderline symptoms: the idea that people with this disorder are impossible to help, manipulative, or destined for eternal suffering. This narrative isn't just false, it's deeply harmful. The inconvenient truth is that our society often prefers to label and marginalize people with borderline than to invest in understanding and proper treatment. It's easier to call someone crazy or dramatic than recognize we're dealing with a complex medical condition that requires specialized care. The mental health system perpetuates this lie through long waiting lists, inadequate treatments, and professionals ill-equipped to deal with the complexity of borderline symptoms. Many patients report years of misdiagnosis or ineffective treatments. Media and pop culture contribute to this mystification, portraying people with borderline symptoms as unstable villains in movies and series, rarely showing the humanity or possibility of recovery. This creates a vicious cycle of stigma and isolation. The most shocking thing is to discover that when properly treated, borderline symptoms respond very well to therapy. Studies show that 74% of patients can achieve significant remission with appropriate treatment. This statistic should be celebrated, not hidden. The cruelest lie is that people with borderline are impossible to love or toxic relationships. In fact, when stabilized, these individuals often demonstrate extraordinary capacities for empathy, creativity, and deep emotional connection. The system perpetuates this lie through treatment protocols that focus on controlling symptoms instead of understanding and healing underlying causes, keeping people in cycles of medication and hospitalization rather than offering real recovery. The strongest proof of this systematic lie is that countries with more developed and less stigmatized mental health systems have significantly better recovery rates for people with borderline symptoms. The problem isn't the disorder, but how society chooses to deal with it. Now it's time to look inside and ask yourself, how have you reacted when you encounter someone with borderline symptoms in your life? Are you part of the solution or part of the problem? Transformation starts with brutal honesty about our own prejudices. The first practical change is to replace judgment with curiosity. When someone close to you displays behaviors that seem exaggerated or unstable, instead of labeling them, ask yourself, what might this person be feeling? How can I help? This simple shift in perspective can be transformative. If you suspect that you or someone close may have borderline symptoms, seek qualified professional help. Not all psychologists and psychiatrists are adequately trained for personality disorders, so look for specialists in the field. Dialectical behavior therapy, DBT, developed specifically for borderline, teaches concrete skills for emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness. These techniques not only help people with borderline, but can benefit anyone struggling with emotional regulation. Medication, when appropriate, can be a valuable ally. While there's no specific medication for borderline, drugs for anxiety, depression, and mood stabilization can help manage specific symptoms during therapy. Building a solid support network is fundamental. This includes family, friends, mental health professionals, and support groups. No one recovers alone, and having people who understand and support your healing journey is essential. Self-care practices such as meditation, regular physical exercise, healthy eating, and proper sleep may seem cliché, but are fundamental for stabilizing borderline symptoms. Body and mind are inseparable in the healing process. Hope is not just possible, but inevitable when we have the right tools. Each person seeking help, each family educating themselves about the disorder, each professional specializing in borderline is contributing to a future where these symptoms are no longer synonymous with endless suffering, but a journey of healing and transformation. Arm yourself with knowledge. The truth simply sets you free.